Camp Connect is a program that creates opportunities for children that are in our foster care system to come together, not just for a visit, but a special visit, special times together. So we create opportunities throughout the year for siblings to do fun activities. One of those activities is a 4-day camp, a 4-day summer camp that takes place in the mountains of San Diego. And in that activity, they're able to horseback ride, do arts and crafts, really do some significant bonding and spend some quality time together. It's our priority to place children together, siblings together in foster care, but not always are we able to do that. So we feel a sense of obligation to really provide them with other creative opportunities for them to do things that other children outside of our system would be able to do. Camp Connect benefits siblings that are separated. When siblings are separated, they really feel a sense of loss. They've already typically lost their family structure, so they've lost that placement with their parents in their family. It's very hard on them. There's a lot of grieving involved. And so through Camp Connect, it really allows them an opportunity to be in a setting that's natural, whether it's picnics or whether it's an activity at the San Diego Yacht Club. I mean, these are all opportunities that really allow them an environment to just be free, be kids, and feel like they're part of a family. Particularly at the summer camp, it's a very exciting event. It's a 4-day activity. The kids are just so excited. The siblings are so excited when they see each other. They hug each other. They're very emotional. We have a lot of volunteers that are involved that participate in chaperoning these activities. And the kids just beam. They just seem to blossom knowing that they're going to spend not just a few hours or not just one day, but 4 days with the siblings that they've been separated from. And it's just an incredible thing to see. In foster care, we always try to make visitation happen between siblings that aren't placed together. There are always some barriers, realistically, that are involved in that, whether they're placed far apart or whether there's some transportation issues. So this really gives us an opportunity to enhance that sibling relationship. I would encourage other counties to contact us directly so that we can share the benefits that we see involved in this program. The other thing that is really an integral part of this program is that public-private partnership. Really, there's a lot of volunteerism that goes into making this a success and to sustaining it. And also, it creates an opportunity for those foundations or those individuals in the community that are looking to help child welfare organizations in terms of how can I contribute, how can I make a difference. This really creates an opportunity for them to engage with us and really touch the lives of foster children. On behalf of San Diego County, we are very thrilled to have received this recognition. We certainly feel passionate about this program and have felt that it was valuable and worth continuing over the years. And so this recognition just validates that. And it also, I think, gives an opportunities for other counties to see what we've been able to do and perhaps be able to do the same thing.
Free foreclosure home clinics started as a way for the county library to provide service to people facing foreclosure. They provide free, fully vetted service for people in the community, introducing them to lawyers, credit counselors, and people who can help them analyze their situation and make a decision that's right for them when they're facing foreclosure. The idea came from a needs assessment we conducted in 2008. We found that the County of San Diego had an increasing number of foreclosures, and we wanted to do something to help because we also saw information that was available was a little confusing. At the same time, the Housing Opportunities Collaborative was looking for a venue to provide more housing clinics, and we partnered up because they were looking for a trusted venue. Around that time there was an increasing incidence of fraudulent mortgage providers scamming people in the community, and it was important to them to provide a safe place for people to know they get trusted information. So they came to the library, and the library is known as a trusted space. And they brought the free legal service, and it was a mutual partnership that has grown ever since. Libraries typically don't provide housing clinics. The housing clinics are a good indication of the innovation that's happening in public libraries. It shows how we're flexible. It shows how we're changing to meet the needs of the community and doing things that people really don't expect. But maybe more importantly, it shows that our peers are recognizing it, and our peers in government and in other institutions. And it shows it's a model, a national model for the country. I think the first thing I would advise is to look and see what's happening in their community. And if they didn't find a good contact, to contact the Housing Opportunities Collaborative, because they have been working with other communities to help them get started replicating the program. And they're a HUD-approved agency that brings collaborating agencies together to provide the service. So the model's there. You know, winning the CSAC Challenge Award, it's a big deal to us. It matters to us because actually it's the first recognition for the home clinics. And since then, we've been honored with another National Innovation Award from libraries. And we think it's a good marker for what's happening in government that's good and in the San Diego County.
In-Home Supportive Services is a state program, and it's locally administered by counties. And we're the second largest county in the state with 25,000 recipients. And this is a program that's designed for low-income individuals who are eligible for Medi-Cal to receive services to allow them to stay in their own home and avoid hospitalization, nursing home placement, or board and care. So social workers go out into the home, meet individually with an applicant, and talk with them about what are their needs for service. They come up with a certain number of hours. That information is communicated via a notice of action, a formal document, to the recipient or applicant, and then they find someone on their own to provide that care. The recipient is considered the employer of their care provider. And as such, they can hire whom they wish. They're responsible for hiring, supervising, and training. And they often will turn to a family member. Our Board of Supervisors is very supportive of the need for individuals to receive care in the home. But when they looked at IHSS as a state program, what they really saw was a program that was careening out of control in terms of growth.
We wanted to ensure that the 25,000 people that we're counting on to achieve the independence and living in their home, quality of life, we're getting quality care and we're getting it by the right people.
They also looked at the integrity of the program, and they said IHSS is a tough program. There's no criminal background checks for providers. There's no one verifying that the service is being provided to that recipient in the home, and there's no one making sure that everything is going well and as it should.
Fraud comes in many forms. Fraud comes in people who misrepresent themselves and their ability to be eligible for a program. Fraud also comes from folks that claim to be the right individual provider of care for a person in need and in fact is not.
So my team developed the IHSS Program Integrity Unit. And what they do is they make unannounced visits to the homes of our IHSS recipients to make sure that they're receiving the care that they were supposed to receive and that it's the right level of care, whether they're receiving the services that are being claimed for and billed for. We also have checked to make sure that we aren't billed for periods of time when the client is actually in the hospital. And we've also been able to determine that some folks may need a higher level of care and make those referrals back to the social worker. One of the other functions we perform is to determine on an ongoing basis if people have died so that we can close the cases timely.
The entire project has been a deterrent of fraud. In February of 2011, we partnered up with the Department of Public Health and Vital Records, which is a department in the County of San Diego. We were given access to their database listing those who have died. We take these names and we screen them, and if there's a match of an active client with someone who has passed away, we let IHSS know. That's actually a big cost savings. The providers are not being paid for services that they should not be paid for because the client has passed away and is ineligible. Since the start of the project, we have screened approximately 17,000 names. We have found approximately 700 matches, which has resulted in about $530,000 cost savings.
We've made 2,500 unannounced home visits. We've made referrals to our district attorney, fraud investigators, and to state investigators when we see that there may be abuse of the system. I think our program integrity unit performs an important service because it assures the taxpayer that dollars that they've put forth to help needy people are being spent the way that they should be spent.
What we find more times than ever is that services are being provided in an excellent fashion in the home. But for those vulnerable individuals for whom this care is a lifeline, we're able to verify that, and if there is a problem, do some follow-up. Our board sent us down this path because of the careening costs in IHSS. 8 to 10% a year was of grave concern, that level of growth. What we've seen since we began our reform efforts is that growth. The first year we went from 8 to 10% to 4%. Since that time, we've gone into the negative zone. If you consider an average of 8% growth being equivalent to about $20 million, in the past 2 years, we've been able to save that amount of money.
It's very gratifying to see this work being recognized. It's important work for a very vulnerable population.
We're truly honored to receive this CSAC Challenge Award. It means a lot, not only for the men and women who work for the Health and Human Service Organization to acknowledge that their work is valued, but it's important for our community, for our County Board of Supervisors, and our goal of ensuring that what we do good for San Diego is something that hopefully could be of benefit for the rest of our great state.